President Trump calls it a breakthrough.
I'm pleased to make a truly historic announcement.
A new step in fighting coronavirus, convalescent plasma, taken from recovered COVID patients, which the FDA says can now be used for emergency use to treat the virus.
There was a 35% improvement in survival, which is a significant clinical benefit.
I don't know where they're getting this 35% number from.
Dr. Vin Gupta is an assistant professor at the Institute for Health Metrics and Evaluation at the University of Washington. He worries today's announcement, which comes on the eve of the Republican National Convention, is, in his words, just smoke and mirrors.
This is just a gigantic exaggeration. I've been using this for my patients in ICUs across Seattle since March. It's pretty widely available. Do we think there's possibly a benefit? Yes, we do. Do we think it's harmful? Probably not. Is this a miracle cure? Definitely not.
Is this a breakthrough?
I'm not sure I would categorize it as a breakthrough. I mean, I think we're all desperate for tools that we can use to treat patients with COVID, and there just aren't that many that we have. This therapy is something that has shown mixed results in early studies.
Dr. Corey Casper is the president of Seattle's nonprofit Infectious Disease Research Institute, or IDRI, and has been directly involved in clinical trials and studies for a variety of potential therapies.
At IDRI, we've been focusing more on approaches that help you generate your own immune response, as opposed to relying on borrowing someone else's immune response. So I think this is a good first step. I'm eager that the work that we're doing here at IDRI, as well as others around the country, will introduce more effective therapies. We're taking baby steps against this disease, and we really need to begin to take giant steps.
In Seattle, Chris Daniels, King 5 News.